we think of sort of our base is how the body grows. So the neurophysiology, and that's sort of like the material we work with as therapists, and what's possible and where the limits are. And then, these different fields, one being attachment theory, the other being emotion regulation, and the other being behavior or discipline.
I think about it, maybe matrix isn't the right word, but almost like a chart where you have categories across the top and categories down the left. And so we have the 4 categories that Kat just mentioned: the interpersonal neurobiology, attachment, emotion regulation, discipline, and learning. But then in each of those categories, we have, what is the science in this category? What do we know about, what does the science tell us factually? And then we have, what does it look like when people are living within the bounds set by our biology? What does it look like when a family is functioning well, and a child is functioning well, and the parenting relationship is functioning well? Then we have a category of, what does it look like when things are not functioning well? And then how do you intervene? And so it is kind of a 4x4 of the chapters and then the subcategories.
Is that the way you all thought about it as you were?
We thought about it as overlapping, and that's what we were always challenged with, is how to organize it, because you pull over here, it's like a web, and then it moves over there, and so you talk over here and you're talking over there, and it all, it was challenging to figure out how to put it into different sections because they all influence one another.
There's a circular quality to everything feeding back. But once we landed on this, let's talk about science. Let's talk about when things are going well. Let's talk about when things are going poorly. Let's talk about how to intervene. And then do that in each of the areas, in emotion regulation, in discipline, in attachment. Then I think that provided a structure where things kind of eased into place.
Well, and I think we came to that because we were really getting clear on our audience, which is therapists. And as a therapist, if I want to read something, I don't necessarily want to read it like a novel, cover to cover. I want to figure out, I'm dealing with this one situation, and I want to be able to use it as a reference as well. And so some of it was to make it like so people could find, so what do I do? And they can go right to the treatment section. Or if they're concerned about what should it look like if it's going well, we have examples of that.
Right.
Another way to look at the book is you can find various entry points to end up in the same place in a family. And so you can look at our chapters and you can look at what it looks like when things are going right and what it looks like when things are going wrong, and decide, in this family, what I need to work on is emotion regulation. In this family, what's askew is the attachment relationship, or these people are asking for discipline help. And so you can use this for treatment planning and figuring out where you're going to begin your focus. And then the chapter itself tells you what you're looking for, what you're trying to achieve, and the concrete steps you can make to move there. And then, inside secret, once you get deep in emotion regulation, you find that it takes you to discipline and it takes you to attachment, because it's all interrelated.